Hello, Mr. James. How are you doing? I hope you are doing well today. Mr. James, I have your results back, and this is the second result for this month. And your fasting blood sugar reading is 7.6 millimole per liter. I am really sorry, and I'm afraid that I have to confirm that you are suffering from diabetes mellitus. Yes, regarding your clarification and concern, let me make you understand that diabetes mellitus or sugar diabetes is a disease in which the insulin is not secreted by the beta cells of the pancreas. The problem with this, the insulin is needed to push the glucose inside the cell. Yes, I can understand your concerns, but even without eating a lot of sugar, you can develop diabetes mellitus. The risk factors which are associated with diabetes mellitus are food, such as high starch or carbohydrates, genetics, means familial history if your parents or relatives are suffering from diabetes mellitus, stress, and other conditions. As per WHO guidelines, 2 raised RBS fasting blood sugar measurements are enough to diagnose diabetes mellitus. So I will not advise you to do any further investigations. But of course, the good side of the coin is that diabetes mellitus is easily manageable and you have to live with it. It's a chronic disease, but you will have a normal lifestyle if you try to manage effectively. First of all, you have to do diet control. In diet control, you have to avoid foods containing starch and carbohydrates. You also have to reduce your caloric intake as well. Your lifestyle modification with addition of exercise will help. And I will further emphasize that I may add medications later on during your treatment. Again, as I reiterated before, we cannot do any further test. I may advise you HB1AC after 3 months, but at this time, what I do would be I will refer you to a diabetic educator which will help you for food guidance. And don't worry, we are with you during this process and everything will be okay. You need to have some mild modifications in your lifestyle and add exercise at least 5 times a week into your daily routine. This will help you to improve your condition of good blood sugar control. Also, we will have to be monitored on a regular basis for any problems with sugar, blood pressure, or cholesterol. You are in safe hands while we are helping you. You don't worry. You don't need to worry about it. With preventive measures, your test will be optimal, and you will not have to have many issues which is associated with diabetes mellitus. Okay, let me reiterate and explain whatever steps we will do. We did the second fasting blood sugar, which is more than 7.6 millimole per liter, which confirms that you are suffering from diabetes mellitus. What we will do is, number 1, I advise you for lifestyle modification with addition of exercise, which can be mild exercise like walking, treadmill, jogging, or anything you like. This should be added to your lifestyle 5 days a week. Then diet control. I advise you to avoid sugar, avoid high starch and carbohydrate food, and also I will refer you to the diabetic educator for good blood sugar control.